Problems with diabetes during pregnancy. Pregnant with diabetes. What are the dangers? Depending on the metabolism before and during pregnancy, children of mothers with diabetes have an increased risk of miscarriage and premature birth. Malformations are also possible, especially in the heart, nervous system, and lungs. Blood sugar levels that are too high can also result in the baby being born with a significantly increased birth weight of over 4,500 grams. Since type 1 diabetes is partly genetic, children have an increased risk of this form of diabetes. The mother is at risk of metabolic disorders, primarily in the form of hypoglycemia, at the beginning of pregnancy. Diabetic complications of the eyes, kidneys, and nerves can worsen during this period. High blood pressure can occur especially later in pregnancy. Good blood sugar control during pregnancy and birth is the best protection for mother and child. If women with diabetes plan their pregnancy carefully, discuss their own risks with their diabetologist, and get the values under control as best as possible before conception, the chances of a largely normal pregnancy are good. In our overview, you can read what is important in the individual phases. 1. Before pregnancy. Ideally, women with diabetes should discuss a planned pregnancy with their diabetologist and gynecologist well in advance. The long-term blood sugar value, HbA1c, should be below 7, or better 6.5%, 3 months before conception. If you have an unplanned pregnancy, women should see a doctor as soon as possible. Before becoming pregnant, women with diabetes should also have themselves examined for existing secondary damage, for example, to the kidneys or the retina in the eyes. The secondary diseases also increase the risk of high blood pressure. Retinal damage in particular can worsen during pregnancy and should be treated. Optimal blood sugar control helps to avoid all of these complications if possible. Also have the thyroid checked for over or underfunction. Specialist societies also recommend starting to take tablets with folic acid and iodine in advance. For example, a good supply of folic acid until the end of the 3rd month of pregnancy reduces the risk of an open back in the child. Adequate iodine intake is very important before and during pregnancy and while breastfeeding. It is best to seek individual advice on these questions from your attending physician. And as for all women who want to become pregnant, it is essential to stop smoking. Diabetes therapy may also need to be adjusted before the start of pregnancy. This depends on how good your blood sugar levels have been so far. Otherwise, the diabetologist may change the insulin. What only applies to women with type 2 diabetes. Many medications that lower blood sugar are taboo during pregnancy. Patients who have previously treated their diabetes with tablets must therefore switch to insulin before the planned pregnancy. Injections and the associated increased blood sugar monitoring are often a big change for women who are previously not dependent on insulin. It is therefore advisable to take a training course to show you how to use the insulin pen or insulin pump correctly. 2. During pregnancy, women with diabetes should aim for the following blood sugar levels during pregnancy. Before eating, 60 to 90 milligrams per deciliter, 3.3 to 5.0 millimoles per liter. 1 hour after eating, less than 140 milligrams per deciliter, 7.7 millimoles per liter. 2 hours after eating, less than 120 milligrams per deciliter, 6.6 millimoles per liter at bedtime. 90 to 120 milligrams per deciliter, 5.0 to 6.6 millimoles per liter at night, around 2 to 4 o'clock. Over 60 milligrams per deciliter, 3.3 millimoles per liter. Hormonal fluctuations during pregnancy make it difficult to control blood sugar levels. At the beginning, the insulin requirement drops. Pregnant diabetics must therefore initially inject less insulin up to around the 14th week in order to avoid hypoglycemia. Later, around the 22nd week of pregnancy, the amount of insulin required increases, only to drop sharply again at birth. Measuring blood sugar regularly several times a day is essential during pregnancy in order to protect yourself against unpleasant surprises. The risk of low blood sugar, hypoglycemia, is increased in the early stages of pregnancy. They can occur especially at night. On the one hand, this requires careful insulin adjustments by the diabetes team, which keeps the risk of low sugar levels as low as possible. In addition, pregnant women with diabetes should be trained in how to properly deal with hypoglycemia. The same applies to your partner and the immediate environment. And acetone levels that are too high can be an indication of an insulin deficiency, which can lead to ketoacidosis, a dangerous metabolic disorder. Ketoacidosis is a real emergency. Pregnant women with diabetes should therefore have established rules of conduct with their diabetologist in advance. Third birth women with diabetes should definitely give birth in a level 1 or level 2 perinatal center. These centers specialize in premature births and high risk pregnancies. This means that those affected are provided with the best possible care, even in the event of complications. In pregnancies with diabetes, the risk of premature birth is significantly increased. Ideally, prospective mothers should take care of a birth location right from the start of their pregnancy. Once the calculated due date has been reached, the diabetes care team will actively initiate the birth. If the fetus weighs 4,500 grams or more, a cesarean section is advisable. During birth, doctors will check blood sugar levels every 1 to 2 hours and, if necessary, correct them with short-acting insulin. After birth, mother and child require intensive care. In the former, the insulin requirement drops in the hours after the birth, which increases the risk of hypoglycemia. Newborns born to mothers with diabetes should receive normal breastfeeding and vaccinations. Breastfeeding reduces the risk that children will later